Hello, I'm Dr. Neil Schultz, and welcome to DermTV. In the DermTV episode entitled Acne Treatment in 3 Easy Steps, I discussed what I'll call regular or facial acne. But what happens if your blemishes are mostly on your back? We call that Bacne, and its treatment requires slightly different measures because of where it is and what it is. It doesn't matter where your acne is, it's caused by the same thing wherever it occurs, but the skin of the back is a little bit different. First of all, because of where it is, you can't see the blemishes, and it's very difficult for you to put the topical medications on them because you just can't reach them, unless of course you have a significant other or a good friend. For that reason, when we treat Bacne, we're more inclined to use internal medications earlier on to help get the medication to all of those blemishes that are hard to get to. Especially, we tend to use internal antibiotics. Also, topical medications can be prescribed in pad form, and with a pad, it's just a little bit easier to reach all of those difficult to get to places. Second, the skin of the back is much thicker, and it's also a little tougher. And because it's thicker, that means that the blemishes are actually deeper, so it's harder to get topical medications to them. As a result, we use higher strength medicines. So salicylic may be 2% instead of 1%, glycolics may be 10% instead of 5%, but we want to use stronger medications so we can try to penetrate deeper. Again, for deeper penetration, earlier on, again, we go to internal medications to try to reach those hard to get to blemishes. The flip side of thicker and tougher, though, is that the skin is better able to withstand the stronger medications without getting irritated. And third, rubbing is involved much more on the back than it is on the face. And anytime you rub acne-prone skin, you're going to push debris and dirt into the pores, and you're going to thicken the skin, both of which contribute to acne breakouts. So with Bacne, make sure you're wearing lighter fabrics and looser fitting fabrics. And one more thing with Bacne. Try at all costs to avoid wearing a backpack, because the additional pressure and rubbing from your backpack has to make your Bacne worse. Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neil Schultz, and thank you for watching today.